Question 1. What does the acronym DMEPOS stand for in the context of HCPCS coding?
A.
Drug and Medical Equipment Provider Organization Services.
B.
Durable medical equipment, prosthetics, orthotics, and supplies.
C.
Diagnostic medical evaluation and prosthetic operating systems. D. Department of Medical and External Provider Operations. Answer. B. Durable medical equipment, prosthetics, orthotics, and supplies. This question tests your knowledge of a fundamental acronym in HCPCS coding. The keyword is DMEPOS, which is a category that encompasses a wide range of items billed with HCPCS Level 2 codes. It refers to durable medical equipment like wheelchairs and hospital beds, prosthetics, artificial limbs, orthotics, braces, and supplies like diabetic test strips. For example, a prosthetic leg would be coded from the L code section, which falls under the DMEPOS umbrella. Remember that DMEPOS covers the actual items and supplies given to a patient, not the professional services performed by a provider. Question 2. A patient receives a 50 milligrams injection of a drug. The HCPCS Level 2 J-code for this drug is described as injection, 10 milligrams. How many units should be billed for this service?
A. 1. B. 5. C. 10. D.
50. Answer. B. 5. This question assesses your ability to calculate billing units for drugs, a critical skill when using J-codes. The key is to compare the dosage administered 50 mg with the dosage listed in the code descriptor, 10 mg. You must divide the total amount given by the amount per code unit, so 50 milligrams divided by 10 milligrams equals 5 units. A common mistake is to bill only 1 unit for the injection itself, but with drugs, you must accurately report the quantity administered. Always check the J-code's description to see the dosage it represents, and then do the math to figure out the correct number of units. Question 3. Which HCPCS Level 2 modifier should be used to indicate a service was performed on the upper right eyelid?
A. RT. B.
E1.
C.
E3.
D.
F7. Answer. C. E3. This question tests your knowledge of specific anatomical modifiers, particularly the E modifiers for eyelids. While RT and LT are used for general right and left sides, the eyelids have more specific modifiers to increase reporting accuracy. The E modifiers pinpoint the exact eyelid. E1 is the upper left, E2 is the lower left, E3 is the upper right, and E4 is the lower right. For example, if a physician removed a small growth from the patient's upper right eyelid, the procedure code would be appended with modifier E3. Think of the E modifiers as providing a more detailed map of the eyes for coding purposes. Question 4. Which category of HCPCS Level 2 codes is used to report drugs administered by a route other than oral, such as injections?
A.
A codes.
B.
E codes.
C.
J codes.
D.
L codes. Answer. C. J codes. This question is about identifying the correct HCPCS code range for a specific type of supply, in this case, injectable drugs. The J codes are a dedicated section of the HCPCS manual for drugs that are typically injected or infused and are not self-administered by the patient. For instance, if a patient receives a chemotherapy infusion at a clinic, the specific drug used would be reported with a J code. A simple way to remember this is to associate J with injection to quickly recall that this section is for injectable drugs. Question 5. Which modifier is appended to a HCPCS code to indicate that an item of durable medical equipment is new?
A.
RR.
B.
NU.
C.
MS.
D.
UE. Answer. B.
New.
This question tests your knowledge of modifiers related to durable medical equipment, specifically those indicating the item's condition. The modifier NU is used to specify that the equipment being billed is new, not rented or used. For example, if a patient purchases a brand new wheelchair, the provider would append the modifier NU to the wheelchair's HCPCS code. Remember this by thinking of NU as new use, which contrasts with RR for rental and UE for used equipment. Question 6. What is the primary purpose of the HCPCS Level 2 code set?
A.
To report all physician inpatient procedures.
B.
To report diagnoses for all patients.
C.
To report supplies, drugs, and services not included in CPT.
D.
To report evaluation and management services only. Answer: C. To report supplies, drugs, and services not included in CPT. This question covers the fundamental purpose and scope of the HCPCS Level 2 code set. The key concept is understanding its relationship to CPT, HCPCS Level 1. HCPCS Level 2 was created to report a wide variety of items and services that don't have a specific CPT code, such as ambulance services, durable medical equipment, injectable drugs, and prosthetics. For example, while a surgeon's procedure is coded with CPT, the specific prosthetic implant they use might be coded with a HCPCS Level 2L code. Think of HCPCS Level 2 as the code set that fills in the gaps for supplies and certain services that CPT doesn't cover. Question 7. When a specific HCPCS Level 2 code for a particular drug or supply does not exist, which type of code should a coder use?
A.
A temporary G code.
B.
An unlisted or miscellaneous code.
C.
The code for the most similar item available.
D.
A CPT Category 3 code. Answer: B. An unlisted or miscellaneous code. This question tests the correct procedure for coding items that are not specifically described in the HCPCS manual. When no precise code exists, the correct practice is to use an unlisted or miscellaneous code from the appropriate section, such as J3490 for an unclassified drug. The keyword here is does not exist, which signals that you cannot use a code for a similar item, as this would be inaccurate. Using a miscellaneous code requires submitting detailed documentation, including the item's name, dose, and cost, to the payer for reimbursement consideration. Always remember, never code for something close enough. If there's no specific code, use the designated unlisted code for that category. Question 8. The L codes in the HCPCS Level 2 code set are used to report what type of items?
A.
Ambulance services.
B.
Orthotic and prosthetic procedures and devices.
C.
Medical and surgical supplies.
D.
Injected drugs. Answer: B. Orthotic and prosthetic procedures and devices. This question requires you to identify the category of items represented by a specific letter range in the HCPCS manual. The L codes are designated for orthotics, which are devices like braces that support a part of the body, and prosthetics, which are artificial replacements for a body part. For example, a custom-fitted leg brace would be reported using a code from the L section. A helpful way to remember this is to associate L with limbs or lifts, as these codes often relate to items that support or replace limbs. Question 9. Which organization is primarily responsible for the annual updates and maintenance of the HCPCS Level 2 national codes?
A.
American Medical Association, AMA.
B.
World Health Organization, WHO.
C.
Centers for Medicare and Medicaid Services, CMS.
D.
The Joint Commission, TC. Answer: C. Centers for Medicare and Medicaid Services, C. This question tests your knowledge of the governing body for the HCPCS Level 2 code set. The key is to distinguish who maintains different code sets. While the American Medical Association, AMA, maintains CPT Level 1, the Centers for Medicare and Medicaid Services, CMS, is responsible for HCPCS Level 2. CMS manages the codes for supplies, equipment, and non-physician services to ensure they are current and meet the needs of the Medicare program and other payers. Think of CMS as the manager of all the national codes for products, supplies, and services not found in the CPT book. Question 10. A patient receives a standard manual wheelchair for home use. Besides the type of wheelchair, what other piece of information is critical for selecting the correct HCPCS code?
A.
The color of the wheelchair.
B.
The patient's weight and any special features.
C.
The name of the manufacturer.
D.
The date the wheelchair was ordered. Answer: B. The patient's weight and any special features. This question focuses on the documentation details required for accurate DME coding. The keywords are critical information, as many HCPCS codes for wheelchairs are distinguished by specifications like weight capacity, e.g., standard versus heavy duty, and features, e.g., elevating leg rests. Simply documenting wheelchair is not enough. The code must reflect the specific type that is medically necessary for the patient. For example, a patient who weighs 350 pounds would require a heavy-duty wheelchair, which has a different HCPCS code than a standard one. Always look for specific details in the documentation that differentiate one piece of equipment from another. Question 11. Which modifier would be used to report a procedure performed on the patient's right hand?
A. RT. B.
F5.
C.
FA.
D.
F9. Answer: D. F9. This question tests your knowledge of the highly specific anatomical modifiers for fingers and hands. While RT designates the right side of the body generally, the F modifiers are used to identify the exact digit. The modifiers F1, F4 represent fingers on the left hand, and F5, F9 represent fingers on the right hand. F5 is the right thumb, F9 is the right little finger, while FA is the left thumb. So, a procedure on the right hand's little finger would be coded with modifier F9. A good tip is to remember that the finger modifiers F5 through F9 are all on the right hand, starting with the thumb as F5. Question 12. What is the main difference between HCPCS Level 1 and HCPCS Level 2 codes?
A.
Level 1 codes are for diagnoses, and Level 2 codes are for procedures.
B.
Level 1 codes are CPT codes for physician services, while Level 2 codes are for supplies and non-physician services.
C.
Level 1 codes are used only in hospitals, and Level 2 codes are used only in physician offices.
D.
Level 1 codes are alphanumeric, while Level 2 codes are 5-digit numeric codes. Answer: B. Level 1 codes are CPT codes for physician services, while Level 2 codes are for supplies and non-physician services. This question assesses your understanding of the fundamental structure of the HCPCS coding system. The key concept is that HCPCS is divided into two levels with distinct purposes. Level 1 is the current procedural terminology CPT code set, which describes medical, surgical, and diagnostic services performed by physicians. Level 2 codes, on the other hand, are used to report products, supplies, and services not included in CPT, such as ambulance trips, durable medical equipment, and injectable drugs. So, a doctor's office visit is Level 1 CPT, but the crutches the patient leaves with are Level 2. Question 13. A Medicare patient is provided with a service that is statutorily non-covered and no advance beneficiary notice. ABN was signed. Which modifier should be appended to the service code?
A. GA.
B.
GZ. C. GY. D.
QW. Answer: C. GY. This question tests your knowledge of modifiers related to Medicare's coverage rules. The keyword is statutorily non-covered, which means the service is never covered by Medicare by law, regardless of medical necessity, e.g., cosmetic surgery. The GY modifier is used to inform Medicare that the provider knows the service is not covered, so an ABN is not required because the patient is automatically responsible for payment. For example, a provider would append GY to a code for a routine physical exam for a Medicare patient, as these are not a covered benefit. Think of GY as telling the payer, yes, we know this isn't a covered service. Question 14. Which of the following is an example of a valid HCPCS Level 2 code format?
A.
99,213.
B.
J7030.
C.
E/M.
D.
453-9. Answer: B. J7030. This question tests your ability to recognize the basic structure of a HCPCS Level 2 code. The key is knowing that these codes are alphanumeric, always beginning with a letter followed by 4 numbers. Options like 99213 are CPT, HCPCS Level 1 codes, and 453-9 is an ICD-9 code format. ICD-10 is also alphanumeric but has a different structure. J7030 fits the correct format perfectly. A letter, J followed by 4 digits. Recognizing this hashtag structure is the first step to correctly identifying and looking up level 2 codes in the manual. Question 15. The HCPCS modifier, JW, is used to report what?
A.
A service performed by a substitute physician.
B.
The use of a CLIA waived test.
C.
A distinct procedural service.
D.
A drug amount that was discarded or wasted. Answer.
A.
A drug amount that was discarded or wasted. This question assesses your knowledge of a specific modifier used in billing for medications. The key concept is accounting for drug waste, which is common when medications come in single-use vials that contain more than the patient's required dose. The JW modifier is appended to the drug code on a separate line to report the amount of the drug that was properly discarded. For example, if a 100 mg vial is used to administer 80 mg, the provider would bill for 80 mg on one line and report the discarded 20 mg on a second line with a JW modifier. This ensures proper payment for the entire vial that had to be used. Question 16. What general category of services do the A codes A0021, A0999 in HCPCS Level 2 represent?
A.
Medical and surgical supplies.
B.
Enteral and parenteral therapy.
C.
Transportation services, including ambulance.
D.
Diagnostic radiology services. Answer. C. Transportation services, including ambulance. This question tests your ability to identify the types of services found in a specific section of the HCPCS Level 2 manual. The A codes primarily cover transportation services, with a large portion dedicated to various levels of ambulance transport. Keywords in the question are codes, which should trigger you to think about transportation. For example, a non-emergency ambulance trip from a patient's home to the hospital for a scheduled admission would be reported with a code from this section. To remember this, think A for ambulance. Question 17. A provider performs a screening colonoscopy on a high-risk Medicare patient. Which HCPCS Level 2 code series would most likely be used to report the service instead of a CPT code?
A.
J codes.
B.
G codes.
C.
S codes.
D.
L codes. Answer. B. G codes. This question focuses on the use of temporary national codes, specifically G codes, which are often used by Medicare to report services that do not have a CPT code. The keywords are screening colonoscopy and Medicare patient, as Medicare has specific coding requirements for many preventive services. G codes are used to report professional healthcare procedures and services that would otherwise be coded in CPT, but have unique reporting rules for payers like Medicare. For instance, Medicare requires a specific G code for a high-risk screening colonoscopy, which differs from the standard CPT diagnostic colonoscopy codes. Remember, G codes are often Medicare's way of saying, report this service our way. Question 18. The HCPCS modifier, LT, is used to indicate which of the following?
A.
The service was performed on the left side of the body.
B.
The service was a laboratory test.
C.
The procedure took longer than usual.
D.
The service was performed via telehealth. Answer.
A.
The service was performed on the left side of the body. This question tests your knowledge of the most basic anatomical modifiers used in both CPT and HCPCS. The modifiers LT left side and RT right side are used to specify which side of the body a procedure was performed on when the body has bilateral pairs, like hands, feet, or eyes. The key concept is laterality, which adds necessary detail for accurate billing and medical records. For example, if a patient has a mole removed from their left shoulder, the coder would append the modifier LT to the procedure code. A simple way to remember this is LT for left and RT for right. Question 19. If a CPT code and a HCPCS Level 2 code exist for the exact same procedure or service, which code should generally be reported to a commercial payer?
A.
The HCPCS Level 2 code.
B.
Both codes with modifier 59.
C.
The CPT code.
D.
Whichever code has a higher reimbursement rate. Answer: C. The CPT code. This question addresses the hierarchy between CPT Level 1 and HCPCS Level 2 codes when there is an overlap. The general rule is that if a CPT code accurately describes a service, it should be used instead of a HCPCS Level 2 code. Many HCPCS Level 2 codes were created to fill gaps where no CPT code existed or for specific payer programs like Medicare. For example, if both a CPT code for brief emotional assessment and a similar HCPCS H code exist, a commercial plan would almost always expect the CPT code. Always default to the more universally recognized CPT code unless a specific payer, like Medicare, explicitly instructs you to use a HCPCS Level 2 code instead. Question 20. What is the primary purpose of appending a modifier to a HCPCS code?
A.
To increase the payment for the service.
B.
To provide additional information about the service performed.
C.
To indicate the patient's diagnosis. D. To replace the need for a written report. Answer: B. To provide additional information about the service performed. This question focuses on the fundamental role of modifiers in the coding process. The key concept is that modifiers add detail or clarify the circumstances of a service, but they do not change the core definition of the code itself. They can indicate things like the location on the body LT/RT, whether service was reduced, or if an item was rented, R versus purchased new, NU. For example, adding modifier -52, reduced services, to a code tells the payer that the full procedure was not completed. Think of a modifier as an adjective that gives the payer more specific information about the noun, the procedure or supply code. Question 21. Which code range in the HCPCS Level 2 manual is used to report vision services, such as prescription eyeglasses and contact lenses?
A.
V codes.
B.
E codes.
C.
J codes.
D.
R codes. Answer:
A.
V codes. This question tests your knowledge of the specific sections within the HCPCS Level 2 codebook. The V codes are designated specifically for vision-related hardware and services. The key is to associate the code letter with the service type. This section includes codes for spectacle frames, different types of lenses, like bifocal or single vision, and contact lenses. For example, when an ophthalmology practice dispenses a pair of eyeglasses, they would use codes from the V section to bill for the frames and lenses. An easy way to recall this is to link V with vision. Question 22. A patient rents a stationary oxygen concentrator for use at home. Which HCPCS modifier should be appended to the equipment code to signify it as a rental?
A.
NU.
B. UE. C. RR. D. RP.
Answer: C. RR. This question assesses your understanding of the modifiers used for durable medical equipment to indicate how the item is being provided. The keyword is rents, which points directly to the correct modifier. The modifier RR is used specifically to report that a piece of DME is being rented by the patient, not purchased. For example, a hospital bed provided for 2 months of home recovery would have the RR modifier appended for each month's billing. Remember this simple trio: NU for new equipment, UE for used equipment, and RR for rental. Question 23. The S codes in the HCPCS Level 2 manual are temporary national codes that are used by which type of payers?
A.
Medicare and Medicaid exclusively.
B.
Blue Cross/Blue Shield and other private payers.
C.
Workers' compensation programs only.
D.
All federal health programs. Answer: B. Blue Cross/Blue Shield and other private payers. This question tests your knowledge of payer-specific codes within the HCPCS Level 2 system. The key concept is that not all temporary codes, like G, K, Q, S, T, are used by all payers. S codes were established by the Blue Cross Blue Shield Association to report drugs, services, and supplies for which no national codes exist, but they are also used by other private payers. However, Medicare does not recognize S codes. So, if you were coding a service for a private insurance plan, you might use an S code that would be inappropriate for a Medicare claim. Think of S as special or side codes used by non-Medicare commercial plans. Question 24. What does the HCPCS modifier, GA, indicate when appended to a service code for a Medicare patient?
A.
The service is statutorily excluded and not a covered benefit.
B.
The provider expects a denial, but no ABN was signed.
C.
The provider has a signed advance beneficiary notice, ABN, on file.
D.
The service was ordered by a court. Answer: C. The provider has a signed advance beneficiary notice, ABN, on file. This question is about the correct use of modifiers related to Medicare's advance beneficiary notice, ABN, process. The GA modifier is used when a provider believes a service may not be considered medically necessary by Medicare and they have the patient sign an ABN before the service is performed. An ABN is a form that officially notifies the patient that they will be financially responsible if Medicare denies the claim. The keyword signed ABN is your direct link to the GA modifier. By using this modifier, the provider tells Medicare, "We have the required waiver, so we can bill the patient if you deny this claim." Question 25. When coding for supplies, such as a sterile surgical tray or dressing provided during an office procedure, what is a key factor in determining if it can be billed separately?
A.
The cost of the supply item.
B.
Whether the payer considers the supply bundled into the procedure payment.
C.
The brand name of the supply.
D.
The time of day the procedure was performed. Answer: B. Whether the payer considers the supply bundled into the procedure payment. This question addresses the important concept of bundling for medical supplies. The key factor is the payer's policy, as many routine supplies used in a minor procedure are considered an integral part of that service and are not separately reimbursable. For example, gloves, gauze, and alcohol swabs used during a simple lesion removal are typically included in the payment for the procedure code itself. However, a more significant supply like a casting material, Q code, might be billed separately. Always check the payer's guidelines to know if a supply is bundled or can be reported on its own. Question 26. Which HCPCS Level 2 modifiers are used to specify the individual fingers and thumb?
A.
E1, E2, E3, E4.
B.
LT, RT.
C. T1, T9. D.
FA, F9. Answer: D. FA, F9. This question tests your knowledge of the highly specific anatomical modifiers available in HCPCS for hands and feet. While general modifiers like RT and LT exist, the F modifiers and T modifiers for toes provide a much higher level of detail. The modifiers FA through F9 are used to identify the exact thumb or finger where a service was performed, e.g., FA is the left thumb, F5 is the right thumb. For instance, a procedure on the ring finger of the left hand would be reported with modifier F3. Think of these F, finger, and T, toe, modifiers as being the most precise location specifiers for the body's digits. Question 27. Temporary HCPCS Level 2 codes, such as G, K, and Q codes, are developed for what primary reason?
A.
To report experimental services that are never covered.
B.
To meet the immediate needs of a particular payer or program before a permanent code is established.
C.
To be used only for inpatient hospital billing.
D.
To replace all existing CPT codes for a short period. Answer: B. To meet the immediate needs of a particular payer or program before a permanent code is established. This question assesses your understanding of why temporary codes exist within the HCPCS Level 2 system. The key concept is that the process for creating a permanent national code can be slow, but payers like Medicare sometimes need a way to track new services or technologies immediately. Temporary codes fill this gap, allowing for billing and data collection until a decision is made on a permanent code. For example, during a public health emergency, CMS might quickly issue a G-code for a new type of testing service. Remember that temporary codes are a solution for timely reporting needs. Question 28. A provider submits a claim for a wheelchair, E1161, but the documentation supporting medical necessity is not yet in the patient's record, though it is expected. Which modifier might be appended?
A. GA. B.
GZ.
C. KX. D. GY.
Answer: C. KX. This question tests your knowledge of modifiers related to medical necessity documentation. The KX modifier is used to indicate that the provider has the required documentation on file to support that the service or item meets the payer's medical necessity criteria. Appending the KX modifier is an attestation that the service is justified and the supporting documentation is available upon request. For example, if a patient meets the specific coverage criteria for a particular type of hospital bed, the provider would add the KX modifier to the HCPCS code. Think of KX as the key to unlocking payment because all requirements have been met. Question 29. A patient with diabetes receives a blood glucose monitor and testing strips for home use. Which section of the HCPCS Level 2 manual would contain the codes for these supplies?
A.
J codes, drugs.
B.
A codes, ambulance/supplies.
C.
E codes, durable medical equipment.
D.
L codes, orthotics/prosthetics. Answer: C. E codes, durable medical equipment. This question requires you to identify the correct HCPCS code category for a common medical supply. Although they are supplies, items related to durable medical equipment are often found within the E code section. The keywords are blood glucose monitor and testing strips, which are classified as DME supplies. For instance, the code E0607 is for a home blood glucose monitor. A helpful tip is to remember that the E-codes cover not just the main equipment, the E, but also many of the supplies and accessories that go with it. Question 30. Which HCPCS modifier is equivalent to CPT modifier 50, indicating a bilateral procedure?
A.
50.
B. BL. C. 2. D.
LT/RT pair. Answer:
A.
50. This question tests your knowledge of how modifiers can overlap between the CPT and HCPCS Level 2 code sets. The key concept is that many CPT modifiers are also accepted as valid HCPCS Level 2 modifiers. Modifier 50 is used in both systems to report that a procedure was performed on both sides of the body during the same session. For instance, if a provider performed a bilateral trigger point injection, they could report the CPT code with modifier 50 whether billing Medicare or a commercial payer. Remember that while HCPCS has its own unique modifiers, it also incorporates the entire set of CPT modifiers for use on Level 1 and Level 2 codes. Question 31. What is the purpose of the HCPCS modifier, GY?
A.
To indicate a signed ABN is on file for a service that may be denied for medical necessity.
B.
To report an item or service that is statutorily excluded from coverage.
C.
To signify that a provider expects a denial but did not obtain an ABN.
D.
To report a service as part of a clinical trial. Answer: B. To report an item or service that is statutorily excluded from coverage. This question tests your understanding of modifiers related to Medicare non-coverage. The keyword is statutorily excluded, which means that by law, Medicare can never pay for the service, regardless of whether it's medically necessary. The GY modifier is used to inform Medicare that the provider is aware of this exclusion, which allows the claim to be processed for denial so that it can be passed on to a secondary insurer or the patient. For example, a code for cosmetic surgery would be submitted with a GY modifier because it is never a covered Medicare benefit. Think of GY as saying, go ahead and deny, yes, we know it's not covered. Question 32. HCPCS Level 2 Q codes are used to report what types of services or supplies?
A.
Temporary codes for procedures, services, and supplies.
B.
Orthotic and prosthetic devices.
C.
Chemotherapy drugs.
D.
Vision and hearing services. Answer:
A.
Temporary codes for procedures, services, and supplies. This question asks you to identify the purpose of the Q code section in the HCPCS manual. Q codes are a category of temporary codes established by CMS to report services and supplies that are not yet assigned a permanent code. The key concept is that they are used for a wide range of items. from temporary drug codes to specific types of tests. For example, Q0091 is for obtaining a screening Papa Nicolau smear. Remember that Q can stand for questionable or quick code, as they are often created to fill a temporary coding gap for payers. Question 33. Which modifier would be used to indicate a procedure was performed on the great toe of the left foot?
A.
LT,
B. T5. C. TA. D.
T1. Answer: C.
Ta.
This question assesses your knowledge of the specific anatomical modifiers for the feet and toes. While LT indicates the left side, the T modifiers provide a higher level of specificity for each individual toe. The modifiers TA through T9 identify the specific digits, with TA representing the great toe on the left foot. For example, a procedure to remove a nail from the left great toe would be coded with the appropriate procedure code, plus the TA modifier. To remember the toe modifiers, associate A in TA with the alpha or first toe, the big toe, on the left foot. Question 34. How often is the permanent National HCPCS Level 2 code set officially updated?
A.
Monthly,
B. Quarterly. C.
annually,
D.
every 2 years. Answer: C. Annually. This question tests your knowledge of the maintenance and update cycle for the HCPCS Level 2 code set. The key concept is understanding how frequently official coding changes are implemented. While some temporary codes can be added more frequently, the main body of permanent national codes is updated once per year, with the changes typically becoming effective on January 1st. This annual cycle allows providers and payers to prepare for new, deleted, and revised codes in a predictable manner. Think of it like the CPT codebook. Major changes are bundled into a single yearly update to maintain consistency. Question 35. When a provider uses low osmolar contrast material during a diagnostic imaging procedure in a hospital outpatient setting, how is the contrast material typically coded?
A.
It is bundled with the radiology procedure and not reported separately.
B.
With a specific HCPCS Level 2 Q code.
C.
With a CPT code from the medicine section.
D.
It is not coded, only noted in the medical record. Answer: B. With a specific HCPCS Level 2 Q code. This question tests your knowledge of coding for supplies in a specific setting, like radiology. The key is to know that certain high-cost supplies, like contrast materials, are often reported separately using HCPCS codes. In a hospital outpatient department, low osmolar contrast material is reported with a specific Q code, e.g., Q9965, Q9967, based on the amount used. This allows the hospital to be reimbursed for the expensive contrast in addition to the imaging procedure itself. Remember that for many outpatient procedures, you must code not only the service but also any significant, separately payable supplies.